Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi, everyone. Welcome back to Wellness Wednesday with 3W. This is the podcast for 3W Medical for Women. Today, we have a special guest speaker. Well, she's not really a guest, but she's Dr. Susan Rutherford. You've heard her on here a ton of times, and she's going to be talking about TB today and her personal experience with it. But I just thought it's a really great topic to just learn more about. You know, we talk about TB a lot, but what does it really do? How does it affect people? And how do you get it? But another special thing is this is our 50th episode. This is our 50th podcast episode. So thank you to everyone that has been listening to us from the very beginning, has been subscribing, has been passing it on to their family and friends. We're so very grateful that you've been joining us thus far. And here's another wonderful episode that you get to listen to. So welcome, Sue, again.
Thank you. I can't believe it's 50.
50. Isn't that crazy?
It is crazy. Yeah.
And we just started it last year. So
yeah. Well, when Helen said, let's talk about TB, I said, TB, why in the world would you want to talk about that? But she said there's like TB awareness next week or this week or something.
Yes.
And so I thought, oh, well, that makes sense.
Mm-hmm.
And actually, TB is a big topic in the healthcare community, and all the hospitals and clinics have to have protocols, and they're very strict.
Yes.
And everybody that's hired has to get TB tests to make sure they're negative. And so it's really a big deal. But in fact, if you go to the CDC, they have some very interesting data. Their last data is from 2019. But, you know, the United States has one of the lowest TB case rates in the world.
Wow.
Yeah, and it's been going down. They've been monitoring it since 1953.
Wow.
For me, that was a landmark year, shall I say, but no more. But anyway, my father had TB.
Yes.
Yeah, he had TB from the Solomon Islands in the South Pacific, World War II.
Wow.
Yeah. But anyway, 2019 was the lowest case numbers on record in the United States, too.
Wow.
The other very interesting tidbit I found on their website was they said that year that over 71% of the reported TB cases in the United States occurred among people born outside the United States. So the big source of TB is really people born elsewhere.
Okay.
So Africa, I know we had a young woman who worked with us for a while, who we said, oh, we got to do the TB screening, and she was a volunteer first, and we do the TB screening to make her an employee, and it was like, oh, well, it's positive. Oh, well, I worked in an orphanage in Kenya a few years ago. So that's where she picked it up, and she had to go through the treatment, the suppressive treatment. Right. The people that are most at risk are those that are living with somebody with TB or people like with HIV whose immune systems are really compromised. It is a bacterial illness, but it's kind of a nasty bacteria in a way. It can't be treated with just any kind of antibiotic. There are only some very specific drugs that are used. And if those drugs aren't taken properly for the full course, you have to take them faithfully, take them for a number of months, take the full doses. If they're not prescribed correctly, then you can end up with drug-resistant TB, and that's becoming a huge international problem. And I know when I was in Africa, I've been to Africa a few times, and mission hospitals, that sort of thing. Yeah. They had a big problem getting people to continue taking their TB medications. Yeah. And so anyway, that's where some of that drug resistance comes from. But there is some in the United States as well. And so it's a problem.
Well, let's back up really quick. So TB stands for?
Oh, tuberculosis.
Tuberculosis.
Yes.
And how you get tested for it, because it's a policy here at the clinic.
That's right. And we actually do test our volunteers too.
Yes, absolutely.
Yes.
Anybody that interacts potentially with a patient,
Yes.
right?
But if you've been previously tested, that counts. You'd have to carry those records with you, though. It's the best thing for someone to do if they're going to move around. If they've been tested, take those records so that you don't have to get retested. That used to be the policy, is that like every couple years, people had to have a TB test if they worked in a hospital. The CDC has changed it. So you, upon hire, before you're actually put to work with patients and everything, you get the TB test, and it's a series of 2 tests, one shot, and then a few days later, a second one to see, whether or not it's positive.
Well, why is it important that everybody that works here at the clinic get tested for TB before they become an official staff person? Why is that important?
Because we don't want to take any risk of communicating it to our patients.
Got it.
Or each other, but especially to the patients. Of course, right now with the masks, there's a lot of debate about COVID, but they definitely help prevent the transmission of TB because TB is airborne. You can't get it by shaking hands or that other kinds of, similar physical contact or sharing dishes. Although when I was a little girl, I remember my mother having this huge frying pan, and after meals, she would wash my dad's dishes, put them in the frying pan with water, and literally boil his dishes and his silverware and everything.
Wow.
Yeah. So to prevent us getting it. And he would have to periodically collect his sputum samples, and those would get sent to labs. He was a veteran, so all this was done through the VA. And when I was in grade school, there were several times when he spent a few months at a time away in some VA hospital, either like I think, was it the Tri-Cities, someplace in Eastern Washington and Portland. We'd drive down to Portland to visit him on some weekends. And it was quite interesting that he got it, right at the end of World War II is when they first started developing some of the antibiotics for it. The first one was streptomycin. But before that, when he first was diagnosed, they didn't have those antibiotics. And what they did was they simply tried to make sure people were well fed and, and otherwise healthy. So apparently the hospital was in Walla Walla. So he came back from Walla Walla one time, and my mother had to get him all new clothes, even socks, because he had put on so much weight.
Oh my gosh.
They fed him and fed him and fed him.
That's hilarious.
Yeah, it was funny. But so when I was in 8th grade, both my mother and I tested positive for TB. We used to have to get tested very regularly down at the King County Public Health Building and get our chest x-rays, and we were going down there every year. But we both tested positive, and then we had to go on a year of medication to suppress it. Yeah. So I have a positive skin test.
Wow.
But so now the screening for me is, well, do you have any symptoms? Do you have any cough? Are you coughing up blood? Do you have any weight loss? My answer to that is I wish. But
don't we all?
No. And basically you start losing weight, you have these respiratory symptoms if you have it. And now the CDC says once somebody's been tested the first time, unless they have a specific exposure, they don't have to do the testing again. They can just answer those same sorts of questionnaires on an annual basis. So that's kind of nice.
So the TB test is, remind me again, because I hate taking it, but it's like an injection.
Yes.
Right under the skin.
Right under the skin, usually in the forearm.
Okay.
And the little bleb of medicine sits there, and your immune system tries to fight it off and so if you've previously been exposed, then your immune system knows what to fight, and it all of a sudden shows up, and it causes your skin to have this red round reaction to it because the immune system has gone nuts trying to fight it off. And that says, oh, you've been exposed, you have antibodies, or you have a reaction to it. So,
and if you don't have TB, it kind of like absorbs into your...
Yep. You can't see anything.
Yeah. So is it... I guess, like, is it important for everybody to have a TB test at some point in their life? Or is it just folks that are working in the medical world?
I think folks that are working in the medical world, in our clinic, we're not too likely to see positive TB cases, and certainly not symptomatic ones. But people that work on inpatient units of the hospital, medical inpatient units, and those that work in pulmonologist clinics or even primary care, they should probably certainly get tested in the beginning and at least the surveying.
Okay.
But those are the people that are at risk.
Okay.
So unless somebody that lives with the person with TB, then they should get tested. But otherwise, people don't need to get tested.
Okay. So we don't test patients.
No, we don't test patients.
Okay.
No.
Okay.
So,
and
if we had a patient that I was worried about because they'd been weight loss and they were coughing up blood and that sort of thing, they came here for their pap smear, but by the way, I don't feel very good.
Sure.
Then I would, as quickly as possible, get them into good primary care to follow up on that.
And is that very easy to have access to, that test? Or
yes.
Okay.
Oh, yes.
Okay.
Yeah, I suspect, especially a lot of primary care offices, they probably have some on hand or periodically have a supply.
Okay.
Yeah.
Is it something for folks that travel a lot to other countries? Is it something wise to get?
Especially, yes. Well, I'd say if you spend any significant time off the beaten path traveling, I'm thinking of Southeast Asia and Africa especially, then that might be worthwhile doing. Is getting a test.
Okay.
Yeah. And travel advisories, you can find those on the State Department website.
Right.
There are travel clinics in this area.
Oh, yes.
Travel medicine clinics, and they'd be the people to talk to.
Okay. And so when you get a positive TB test, you said they go on a certain medication and you have to take it for a certain amount of time.
Yes.
What is that medication again? It's an antibiotic?
Well, there's several different ones. And there's several different medications. And basically taking into account whether or not they think there's a risk of it being multi-drug resistant.
Okay.
So.
Okay.
Yeah.
And once you take that medication consistently until it's gone.
Yeah.
Does that mean the TB is no longer inside your body or?
Well, that's what I thought until I talked to somebody a number of years ago who said that it still could reactivate. You might have a little pocket of it. But the drug I took was isoniazid. But there's like rifampin. These are pretty hefty antibiotics and usually only used for a few types of bacteria.
Okay.
Yeah.
Does TB impact reproductive health at all?
Yes. Funny you should ask. TB can be a cause of infertility. People can have TB, they call it latent TB, not know they have it, but it can not just affect their lungs, but it can affect their internal organs, especially, believe it or not, the fallopian tubes.
Wow.
So they can end up with blocked, damaged fallopian tubes as a result of tuberculosis. It's a common cause of infertility in Africa.
Wow.
And one time when I was in Africa,
story.
Yeah. They did the first ever laparoscopy at the hospital I was visiting and helping with. First ever one they'd done. And they looked inside, and her entire lining of the abdomen was covered with all these little white dots, little white bumpy dots all over the place. Something called miliary tuberculosis. And so they took a little biopsy of the lining of her abdomen, and she had it all over her tubes too. And so they took a little biopsy, and I actually sort of smuggled it back in my luggage.
For research people.
Yeah, that's right. Well, the problem is they were so isolated that trying to get it to a pathologist in Africa to process and examine would take months.
Right.
Yeah, and I'm leaving next week. Why don't I just take it home and we'll get you word by primitive email at that time, but still by email.
Yeah.
And so you'll know within a few weeks the results.
That's hilarious.
Yeah. So that's what we did.
Dr. Rutherford, smuggler of TB samples. So can you see the TB on fallopian tubes through ultrasound or through like a
probably not through
transvaginal?
ultrasound. This probably you have to do it surgically. In this case, it was a laparoscopy.
Okay.
But yeah,
So it's not something you can detect with an ultrasound
you
machine.
wouldn't. No. No, and you might detect that the tubes are blocked or something like that through trying to inject dye up into the uterus and watch it go out through the tubes under, under X-ray. But that's a common procedure done to work up infertility to see if that's one reason somebody's not getting pregnant. And that could be TB, it could be previous infection, pelvic inflammatory disease, endometriosis, lots of reasons. So you're not going to see it on ultrasound as to which of those reasons is causing the tubal problem.
Got it. Okay. So the only way that you could detect if you have TB in the original place or in your fallopian tubes is through that test, correct?
That will tell you if your body has had TB and has formed a response to it. Yes.
Okay.
Yes. Okay. Whether you got sick from it, I think they just always consider it potentially latent TB if you have a positive skin test but no symptoms.
Okay.
Yeah, but it needs to be treated because it can sit there for a long time and eventually cause serious illness or death. So,
why do you think the numbers of TB affected folks have dropped in the United States? Why do you think that's happened?
That's a really good question.
Is it because we're more diligent in testing?
That could be. It used to be that when people were immigrating to the U.S., they had to have a chest X-ray, they had to have a TB test, they had to have, I think, testing for hepatitis, something like that. Because when I was stationed overseas in Japan, and we'd be part of processing people, giving them physical exams as part of their immigration protocol. Well, although it's not clear why it's going down, it's very interesting that the majority of cases TB cases in the United States occur in California, Texas, New York, and Florida.
Why specifically those states?
I'm thinking because of the immigration
high immigration?
Yeah.
Okay.
High immigration levels.
Wow. Okay.
Yeah. Since over 70% are found in immigrants.
Yes.
Yeah.
Yeah.
So
the medication that you take, are there any side effects to the medication that you take to cure TB or to manage TB?
So, yes, I don't know all the side effects.
Okay.
I'd have to look them up again. I experienced one of them from the isoniazid, and that was that I started losing my brain.
Oh.
I started flunking math tests. Math was my best subject.
Yeah.
Yeah, I couldn't believe it. I started having trouble remembering people's names.
Wow.
And my mother, who usually had every single phone number of anybody she knew memorized, she couldn't remember those, and we were both going through this at the same time.
Yeah.
So an internal medicine friend of the family, friend of my father's, had put him on vitamin B6, pyridoxine. And so we started on that. He said, this is what's going to help you. And we started on that, and it was amazing to recover our memories and our brain functioning and everything. But it was a really good experience because I had a few close friends in junior high school. This was when I was in junior high, who were C students, and I was an A student without a lot of work at it. But these were just wonderful people, and we were good friends, and some of them I'd walk home with and that sort of thing.
Right.
But they'd struggle, and I still loved them, but I didn't understand, didn't really talk with them about it. But then when this started happening to me, I thought of them. I had one friend named Kathy, and I thought, oh, this is how Kathy feels all the time, So everybody has to find, of course, where they're gifted and where they can truly have a very satisfying life. And it's not going to be academics for everybody.
Right.
So, but that was really interesting. That gave me a real opportunity to kind of walk in somebody else's shoes.
Yeah.
And so I've always remembered that. And when I feel frustrated with a patient or a coworker or something, it's not very often with the coworkers here, I must say, but when I feel frustrated, I think of that. And I think, okay, what am I missing? What would it feel like to be in their shoes? And so I know we were talking about TB, but TB has a philosophical aspect for me.
Yeah.
And it's that story in particular.
Wow, that's so good. That's really powerful, Sue, that you were able to get such a huge emotional experience out of it too.
Yeah. Yeah.
Wow.
Yeah. That was a gift.
Well, anything else our listeners should know about TB that you would like to share?
No, just encouragement that if you have any relatives or friends or people that have come from overseas in particular, this is something they should probably check
And
into.
take seriously.
And take seriously.
Yeah.
Yeah.
And it looks like the ability to test is very accessible in a lot of different places.
Oh, yes.
Yeah. Okay. Well, listeners out there, if you have any further questions for us on like where to go, if you've been potentially exposed or have family members that are coming to visit, like Dr. Rutherford said, and you're a little concerned, please give us a call. We're very accessible to you, and maybe we can help navigate that conversation for you and navigate where to go to get resources.
We're not experts on TB, and there are a lot of things we're not expert on, frankly.
Yeah.
But what we are expert on is we're really good at saying, we're not going to give up.
Yes.
We're going to try and find an answer for you.
Yes.
Even if we have no clue what's going on, or point you to a place where to go.
Yes. We're only a phone call away to do that for you. So thank you so much for listening. Thank you, Sue, who's so wonderful and sharing with us your personal story about your dad. And I know how much he means to you. And so this was really great to be able to mention him in a podcast. So thank you so much for all of our listeners for tuning in. And here's to episode 50. And thank you so much. Bye-bye. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.